what a prostate was back then. And the only reason I had the test done is because a friend of ours, who was father of my wife's employer, he had his prostate done and had his PSA done and kept insisting that I have mine done. And it was through that insistence and my wife's prodding that I finally said to the doctor, look, this is my $25, because that's what it was back then, and I want to have this test done.
From the time I turned 50, my doctor, bless his heart, said, Mike, you've turned 50, and I want to start, you should have your blood tested for PSA. It's not covered by OHIP, it's an extra $30 out of your own pocket, but you should do it every year from now on. And he recommended that I do it, and I followed his advice. And you know what? It saved my life.
My doctor used the digital rectal exam, and she said, I feel something and I'd like you to go and have that investigated. And so I otherwise wouldn't have known. So the diagnosis was picked up, or at least the early diagnosis was done by a routine DRE.
Well, the PSA was relatively a piece of cake because it was just a blood test. It became more important when we did the next PSA test and found out that my PSA had doubled rather quickly. That meant that the cancer, should it be there, they discovered, was aggressive.
We had the PSA results that showed us that we very likely had prostate cancer, given the family history. But we wanted to be sure, so we did the biopsy process.
I knew it had to be done because my PSA had risen. Still below normal, but had risen from one year to the next. So I knew that something had to be done to find out why it had risen, and whatever it was, let's do it.
Because I really wasn't sure what the process was going to be. It was explained to me what I felt through medical terms, but through a layman's terms, I wasn't absolutely sure what this was all about.
When he diagnosed me, he told me I had prostate cancer, and he explained what that meant, and I had a decent idea since my father had prostate cancer. I would say 16 years previous to me being diagnosed, so I was aware of prostate cancer, and I was also aware that you could survive it.
I accepted it as routine. I had no problems accepting the various procedures you have to go through.
I accept the fact that I'm going through with this. But I sort of went in what I would consider to be somewhat of a numb state, because this is what I have to do. This is what needs to happen. So I trust the health and the caregivers. So consequently, this is how it is. So it's accepting in one sense of the word, but it's also numbing myself, in other words, my feelings or whatever, because this is what it is.
I would advise that to anyone who's going through this process, to bring their spouse, a significant other, brother, sister, somebody to help with the process, because it's there's a lot of information, there's a lot to be processed, a lot of thinking and a lot of knowledge that is being passed along by doctors and practitioners, and you really do need help with that. So don't try to do it yourself.
At the time I felt a little isolated. A little bit of a guinea pig, even though I wasn't the first through these things, but it was first for me, and certainly a little uncomfortable with some of the testing. I personally found the biopsy treatment or testing the worst that I went through. When they use that gun to take the little biopsy samples, it hurts. The more samples I take, the more you end up feeling sore, and I certainly came out feeling a very tender rear end for a good few hours later.
The digital exams I've been doing for a little while, so that wasn't a challenge. The biopsy was the biggest procedure. I had never had major surgery in my life. I had never had a biopsy, so I was told what I was going to experience. But during the actual biopsy, I would have to say that I had imagined it being on a scale from 1 to 10, 10 being, oh my goodness, this is the worst thing that's ever happened to me, and 1 being a mosquito bite. I would have to say it was a 4 or 5. It was a very intrusive procedure, but not nearly as bad as I had envisioned in my mind from a pain standpoint. Yes, there was the after effects of the bleeding and so forth, and the pre-treatment to prepare myself for the biopsy. But the biopsy itself wasn't nearly as bad as I thought it was going to be, so I was pleasantly surprised.
The first biopsy I had was extremely uncomfortable, extremely painful, and proved to be negative, ironically, after all that. The second biopsy I had was about 6 months later, because my PSA had continued to elevate. Turned out to be positive, and it was a very positive experience. I had no discomfort. It was a different doctor who performed it, and it was just in and out of the hospital, boom, boom, no problems at all.